There we are.
All right.
Stay close.
Yeah. So part 2, I'm Dr. Dawn Psych, MD, your most influential double-boarded child, LS and adult psychiatrist, ADHD expert, 2-time best-selling author, podcaster, public speaker, media influencer, and also acute mental health strategist for professional athletes.
And I am Dr. Sasha, your dual doctorate board-certified, award-winning physician, researcher, best-selling author, international speaker, and medical cannabis expert. And we are here actually for part 2. We are double Facebook Living.
Yes,
right?
Yes, double Facebook
Dr.
Living.
Dawn's on her page, I'm on my page. So hello,
right.
everybody. So we are back. We are in Atlanta at the Momentum in Medicine Conference, and so we want to take some time to just chat. So we actually, this is part 2. So my goodness, if you actually listen to all of part 1, this is part 2. We're following up with what we ended up with. We were starting to talk about movement disorders and its use, and you had some questions. But I think the concept was, what were we saying, right? While we were in the break, because we lost power and had to, get back online and all that good stuff, right? But we actually were talking about the disconnect.
Yes.
In the fact that there are physicians who actually still don't know so much of the research that's out there, what's beneficial outside of their field. Okay, so as a family medicine physician, I actually have a depth of knowledge across all of medicine that I have to know a little bit, actually a lot, about a lot. And like Dr. Dawn knows a lot about
like children, adolescents, and adults.
Yeah, right. Psychiatry.
Psychiatry.
So, like, sometimes as physicians, we are, we have our field of study, and we're so busy, right? So it's hard. Nobody can keep up. That's why we have different lanes that we all stay in.
Exactly.
Very valuable, right?
And when you specialize, like I was mentioning with Dr. Sasha, I was not aware of this research going on with, cannabinoid use and Parkinson's or movement disorders because because I'm a child psychiatrist, right? So I see the opposite end of the spectrum. But it's so interesting to know. First of all, I want to know because I love medicine and the art of medicine. But I also want to know because a lot of these questions come up, during sessions. Because, like, for example, a parent may be depressed because, her father was diagnosed with Parkinson's and he's, debilitating. So, I'm treating her depression, but I'm not treating her depression, right? And so she may have some questions for me about, her father's Parkinson's, and I can defer, based on, understanding more knowledge and understanding, maybe start the conversation, but have an expert like Dr. Sasha continue it, and so I think and that's how I feel that that's wholesome treatment for our patients. It's not just about, what we do or specialize in. Dr. Sasha and I have an overall awareness and how we can provide the best help for you and your families. And so when to defer, when not to defer, when to start conversations is important. And so having this knowledge, I can't wait to go and read some more about this because that's very interesting.
Yeah, and likewise, when I have patients that are, complicated patients who, whether it's a mental health disorder or mental health challenges or some sort of psychiatric disorder, I have my limit as to what I can help these individuals with, and that's where I send them to you. So it's really important to have this team approach, but I also think, like you said, it's important to have this conversation, right? Because if as physicians we don't know what we don't know.
Exactly.
Like there's a limitation in helping our patients.
That's right.
And so I obviously know what I don't know when it comes to psych because there's so much to know and it's so complicated. Have I said that enough? Like 50 times during this thing? It is very complicated, the psych world. But at the same time, outside and what I do outside of psychiatry, in family medicine, there's a lot of benefit for cannabis, right?
Yes.
So we were actually having can I talk about the conversation we were having?
Let's talk about it.
While we were trying to get this set up. So, I asked Dr. Dawn, because, listen, we are all influenced by a lot of things, right? We have our biases, whether it's from the way we were brought up, where we were brought up, what our value system is, and all of that, right? So, that can impact how we think and feel about things. We have our medical training.
That's right.
Which, for the vast majority of physicians, they either never discussed the endocannabinoid system, or if they did, it was in passing. Okay. Now, my PhD that I, started in that field 25 years ago and got my PhD almost 20 years ago. I mean, when we talk about talking about the endocannabinoid system, there's a lot of information, right?
Yes.
So there's a huge disconnect because between what is in the literature and what we know as physicians.
Right.
And that's why one of my passions, I help patients with medical cannabis. I educate physicians on medical cannabis, and I help the medical cannabis industry on how they can meet the needs of both patients and physicians. Because really, as physicians trying to help our patients, that educational piece is lacking.
Yes, it is.
Right. So
yes, it is. Look at all those. I see
we
hearts. I see thumbs up.
Right. I mean, and so as far from the physician piece, that is how I am able to expand my reach to patients outside of the clinic walls. Right. I get to spend time with physicians, educate them on medical cannabis, and then they can go out and help their patients.
Which she's doing today at Momentum of Medicine in Atlanta. She's one of the key featured speakers today in Atlanta. And so when we talk about Momentum of Medicine, this is a 4 or 5 day conference that we're at. And actually it's awesome because you have different physicians of different specialties. And so Dr. Sasha is one of the main speakers for our afternoon session. So
yeah.
And
I'm talking about why, 5 reasons why physicians need to elevate their medical cannabis knowledge. And that's actually my topic here in Atlanta today, with a room full of amazing, very educated, amazing physicians. I cannot tell you. Listen, we are blessed to have these physicians who are at this conference. I'm not talking about myself. I'm talking about the people who are attending, so that they can be better physicians for their patients. And so I'm really excited to share that knowledge, right? And on a side note, I also have a Medicanna Academy, and so that actually starts in a week, and it's a one-of-a-kind online, 6-week online course where I teach physicians internationally on how to help. We talk about having a practice with medical cannabis. We talk about bringing the cannabinoid science with medicine, physiological, chronic conditions, and how we can, how those integrate. We talk about how they can help their patients with that. And so they leave from the 6-week course really knowing so much about how to have a discussion with their patients or recommend a treatment. Right. And so it's incredible to be able to have that. I know sometimes I'm not there in the office because I'm there, educating, and but really understand, for me, it's a deeper purpose to be able to just live my life having as much impact as possible. I love my patients, but one of the ways that I can truly help as many patients as possible is through doing, you and I both, what we're doing here, right?
We love educating,
social media, harnessing
awareness.
that, and saying, look, these are some things that as individuals you need to know, right? So we're stepping out of our offices,
we are,
and we're reaching out, really,
exactly,
internationally. So I love
and
it.
that's why we're here too, to learn more knowledge, right? And so I guess one question I have that I wanted to actually bring up is, patients ask, well, is this legal? If cannabinoid oil is available, or cannabis, by inhalation is available for anxiety, depression, is it legal? And how can I find that doctor that can help in assisting me in having this discussion if this is a suitable, safe, proper medication for me?
So in the United States, it is still a federally illegal or illicit drug. Okay, so federal laws still state and is in place that cannabis is an illicit drug. However, states have made determinations individually as to whether they want to allow medical or recreational cannabis. Now, American history, right? We have state laws, we have federal laws, and so it's very complicated. However, we have, like I mentioned in the last part, about 33 states that have some form of medical cannabis laws allowing medical cannabis, and we have about 8 or 9 states that also have recreational cannabis. And so, is it legal? It depends on your state. What is legal in your state?
And legal for what particular, condition? Right.
And then there's the issue of hemp CBD, which is governed by the Farm Bill. We just had a new Farm Bill that was put out and updated in 2018.
Okay.
So that expanded hemp CBD across all states.
Right.
But remember, each state has the responsibility to lay out their own laws about that. So
and I
be
think that's where
mindful,
a lot of-
people.
Yeah, that's where a lot of the clarification. So thank you so much for explaining that, because I know there's questions out there about that part about it as well, because it can be confusing to understand that. Yes.
Well, we wanted to make sure Dr. Dawn's beautiful face is in here because
Yours, yes.
we're working on her laptop, my phone,
Yes.
and so I don't want her to get out of the field there.
I apologize. Yes. So, a common question is, well, can I really take this for anxiety? Can I take this for depression? And I think Dr. Sasha brought up a good point is that, there are certain laws, federal laws and state laws. So you really have to, find that out, right? And how can they go about doing that, Dr. Sasha? I mean, is that something they ask their doctors? That's something they ask a representative? People don't want to talk because they feel like they're asking something about a legal, these are some really general questions that people are having.
Right.
And so, if this is something they want to pursue, how do they go about it?
I actually try to keep in touch with what's going on in my legislature every single year. Mm-hmm. So there's what's going on in the country, but there's also what's going on in your state. And so if you can hook up with entities in your state that keep you abreast of the legislation in your state, that really is the best way that you can get information that you can really sink your teeth into.
I see.
There are some websites, the Normal website, Normal, NORML, I don't know if it's .org or .com, but it is the website, that National Organization for Marijuana Legalization and Reform. They post updates, and so that's a place that you can actually find out more about what's going on in your state. I mean, right now, guys, legislative sessions are in play in many states. We have over 1,000 bills across the state right now legislatively that are being that have come to the table.
Wow.
Right? Over 1,000. So just that it gives you a sense of many states are either improving, tweaking their cannabis laws as we speak.
Right. So I guess another question would be, well, how can someone find someone like you? Because I know Dr. Sasha practices in Florida. And so, if I'm in Texas, how can I actually just, schedule an appointment and just, become informed about this, just make an informed decision if this is kind of the route I want to go and involve my,
And so, because I work with physicians really internationally, but I know this is primarily the U.S., so I have many physicians around the country in many states. And so if you reach out to me at drsashano.com, that's www.drsashano.com, and send me a message. Let me know where you are, and we can try to find a physician that I can recommend to you. I have many physicians who have either taken my Medical Cannabis Academy course, so I know that they are really well versed in the endocannabinoid system and how they can apply medical cannabis to medical conditions. So contact me, we can get that information out to you. You have different state societies that you can search. I'm always really weary about just that Google search. You really have to understand, a physician may be recommending for a long time, but their level of expertise may not necessarily be what every patient needs it to be. And as a matter of fact, I do consultations for patients outside of Florida. So
should patients be looking for a particular certification? Because, there's psychiatrists who specialize in...
Right. There is no official, American, APA for you, or AOA, ACOFP, or AAFP for family medicine. There's no official designation for that. Some of the states do have societies and some organizations that have been put together. But from the AMA and the AOA standpoint, there is no official residency or specialty in this field, right? So you really have to do your homework. Feel free to contact me. Even in states where recreational cannabis has been around for a long time, like for example, when we get back next week, I'm consulting with someone from California about their child, and so I may not be able to recommend actively in the state, but I can have a consultation with you and just be able to help, because
that's valuable.
It's so hard to know sometimes, and it gets really confusing. And so you can certainly also go to my, for those of you, I'm Facebook Living on my group, but for Dr. Dawn's, go to Dr. Sasha No on Facebook and, follow me there. And I try to do as many updates as I possibly can. It's not just specific to Florida.
Yes.
But also providing valuable information for patients. So
This is amazing. This is amazing to have direct contact with a specialist who does research. She's PhD. You hear that? PhD as well. And so she has a lot of expertise and experience in working with this with this population and this topic. So, she's giving you an outlet to reach out to her. And I know I will be, for sure.
Listen, when I started in this field 25 years ago and I picked the topic for cannabinoid research at the University of South Florida's College of Medicine 25 years ago, I was looking for a topic that would be interesting and keep my attention so I can complete my PhD. And I had no idea that it was going to be the way that it is now. I had no idea that I'm sitting here with you, being the only known physician in the U.S. who has a PhD in this for almost 20 years in molecular and cellular cannabinoid research. It's kind of crazy. I mean, it's just a testament to me of my faith in God, and just going like that journey has just led me here.
That's amazing. I told you she was amazing.
And so now I get to use that to help as many patients as possible, many individuals, not just patients, so many individuals. So I'm really excited about that, and just really being able to serve as much as possible.
Oh, you're amazing. We really want to appreciate our followers. If there's any questions, please put them in the chat.
Yes.
Even if this is a repeat for you, we want to make sure that we have your questions answered. We're going to actually share this with all our social media platforms so that we can continue to have this open discussion. We're going to get together more about topics too, because I know we kind of went off course a little bit, but
remember, she's the ADHD specialist.
Right?
I probably have a little myself. I probably need to see you, Dr. Dawn.
No, but this is such a hot topic, right? And so even though we care about it, there's so much that we can talk about this. So if you have any questions, specific questions, put those in the chat or inbox us, and so we can address them if you want to do it that way. Whatever makes you feel most comfortable, but it's likely that someone else has the same question as you. So we definitely want to address all your questions, on Dr. Sasha's platform as well as mine as well.
Yes.
So, yes.
Well, thank you all for joining.
Yes,
and
thank
so
you.
for more information, you can visit. I'm going to let you do your stuff, but I'm just going to let people know. For more information, you can contact us. My Facebook handle, as a matter of fact, across all social media is DrSashanoe, Dr. Sasha No. You can contact me across all social media, or you can go to my website at www.drsashanoe.com, DrSashanoe.com.
Yes.
Dr. Dawn?
And then for me, my actual handle across all social media platforms is Dr. Dawn Psych MD. That's DrDAWNPSYCHMD. And you can also find me on my website. That's www.drdawnspsychmd.com, where I also offer consultations as well, no matter what state or country you're in. Yes.
Well, thank you guys for joining us. We're going to sign off. I think we're successful on the double
I
Facebook
think we
Live.
are, yes.
A little bit of a hitch, but we got over it with technology. You guys have a great weekend. Love you guys.
Take care.
Bye-bye.
Bye-bye.